Welcome everyone to IsisParenting's breastfeeding webinar and chat. My name is Nancy Holtzman. I'm a mom and baby nurse educator, board certified lactation consultant, board certified in pediatrics, and mother of two teenagers. And I'm here in Boston, Massachusetts. And with me today is Katie, who's be moderating in the general chit chat room. So thank you for helping out today. And today our topic is going to be childcare, caregivers, and breast milk. So we often talk about pumping and storing and feeding and preparing to return to work. So now we're actually going to talk about the nuts and bolts and the nitty-gritty of bringing milk to childcare and working through various conflicts and concerns and issues regarding um, attitudes, policies, logistics for transporting milk, making sure you've got enough bottles, and figuring out how it all comes together, and then in particular, the combination of starting solid foods and feeding breast milk. So my most important message to you as a woman who is preparing to return back to work or is back at work in the trenches, as I know many of you are, is it sure as heck is hard. This is hard stuff. And in the day to day of it, it can be very time consuming, tedious, overwhelming, and stressful. In the long term, big picture of it, it's a short period of time in your child's life, yet a very important period of time. So looking back, you may think to yourself, gosh, I wish I continued to breastfeed longer, or I wish I hadn't quit in a moment of overwhelm and despair. But I think that it's very realistic to look at your day and your responsibilities at work and determine what combination of feeding is going to be doable for you. Another thing to remember is that if you do go back to work roughly around 3 months, as many people do, it's a relatively short period of time that you need to focus on kind of keeping up with your milk production, because roughly 5.5, 6 months, you begin playing with solid foods, and we'll talk at length about that. And so your baby's milk intake begins to level off again as well at that stage, and you will not need to continuously be producing more and more milk. Their milk intake levels off, and if you can just keep up for the first month to 2 months of returning back to work, really, you're going to be golden at that point. You can do this. And when your child is in child care, they're exposed to so many different germs, and you may or may not know that your breast serves as an immune factory, even for viruses that you yourself are not exposed to. So say, for example, your 6-month-old is sitting on the playmat and another baby rolls over and sneezes thick green snot right in your baby's face. So your baby is now exposed to this delicious cold virus, and the baby will come home and breastfeed, and through the virus in the baby's saliva, enter into your breast, which actually will create immunities for the baby that's passed through back in the breast milk. So you can actually protect your baby from illnesses that you yourself were not directly exposed to through your breast milk. It really is a pretty miraculous substance. So looking at how to get started in terms of keeping those lines of communication open and working as a team with your caregiver, it's really helpful to think a little bit about what their concerns are. Sometimes the conversations and pressures that they may bring up with you have a lot to do with their own anxieties and concerns. So for a mom that's back at work and is pumping and kind of living what I call paycheck to paycheck when it comes to breast milk, ounce by ounce, you're measuring out the ounces for the bottles very, very carefully. You're a little bit obsessive perhaps about how many ounces you're sending and how many ounces the baby is drinking. And the caregiver really can pick up on that type of concern. And the caregiver, of course, may be accustomed to working with families with formula feeding babies. And the formula feeding babies typically take much larger volumes of milk at a sitting. And there's very little concern over how much milk the baby is or isn't taking, because there's always another bottle of formula that can be available. So I think that the caregiver picks up on some of your focus on the volumes of milk, and that makes them anxious because, of course, their concern is they want to make sure your baby is content and not crying, and they always want to know that they have something else they can offer the baby. So I think it makes a caregiver concerned when moms are concerned about limiting the amount of milk that they're allowing the caregiver to offer. Um, Another thing to think about are limitations to the actual abilities, what the caregiver can and can't do. So for example, for a baby that's having a hard time taking a bottle, um, if the caregiver needs to spend a lot of time trying to coax the baby to take milk from a sippy cup, for example, or an open cup, or you want the caregiver to hold the baby in a very particular way while bottle feeding, they may or may not be able to accommodate that on any given day or any given feeding, depending on the needs of the room and the other caregivers available and the other baby's needs. So it's important to remember that too, that there may be 6 or 8 or 10 babies in the room and 2 or 3 caregivers, and they're all trying to take care of each baby. Remember that child care facilities and caregivers do have rules and regulations that they need to follow. Some are set by the child care facility itself. Others are set by the credentialing body of the state. So for example, here in Massachusetts, there is a very clear state law that says that any milk remaining in a bottle that's been warmed and offered to the baby must be used or discarded within 1 hour. That's not the caregiver being difficult. That's an actual rule or regulation that they, as a licensed facility, are required to follow. There are loopholes sometimes. For example, on Tuesday in our sleep webinar, we talked about sleeping in childcare environments and the fact that many daycares in many states will not swaddle a baby over 6 weeks old because that's in their state legislation for the childcare facility. But with a doctor's note, if you can have the pediatrician sign and write a note that says that the baby can and should be swaddled for sleep, then that is like a disclaimer for the child care environment, and they're willing perhaps to do that. So many child care environments will have what's called a breast milk bottle waiver, and there's a PDF link here that you can click to see what that looks like. The one I'm showing is Bright Horizons bottle waiver. They will not feed milk that's left over after an hour to the baby, but they will put it back in the refrigerator and return it to you. So then you could bring it home and you could feed it to the baby, or you could blend it in cereal for dinner for the baby's solid foods and so on. So understand what their policies are, where the policies come from, and are there any alternatives that you can kind of work around. Another caregiver issue I didn't bring up is if it's a family member like your the baby's grandparent who is caring for the baby, they may not be familiar with breastfeeding or the appearance of breast milk. So sometimes that comes up too, and they just may need a little bit of educating that the milk is supposed to separate and look like that. No, it's not too thin or watery. Yes, that's the right amount of milk for the baby, and so on. So the burning question many moms have is, how much milk should I send? And of course, many moms who are home with 4, 8, 10-week-old babies getting ready to think about returning to work are anxious because they're full-time breastfeeding, trying to pumping relatively smaller volumes of milk and trying to store that milk, and are very anxious about how will they pump more milk and how much milk will they need to have in the freezer, and how much milk will their baby need each day, especially when a baby is mostly breastfeeding. You'll see that there's actually 3 different types of considerations. There is the way a baby breastfeeds at home when he's with mom. There's the way the baby bottle feeds when he is in childcare, and then there's the way that mom pumps at work. And those are 3 separate, interrelated but unrelated things. They don't need to follow the same pattern. Your baby, during a 10-hour period at home, may nurse and doze 5 or 6 times, but in childcare will probably take 3 bottles, and it will probably require you to express 3 times in your work setting, although they don't need to be done at the same time every day or the same time the baby takes the bottles. If you're returning back to work around 12 weeks of age, a good approximation is that your baby will probably require 3 full bottle feedings, and I would assume that that would be roughly 3 to 4 ounces. I always like to suggest sending an extra bottle or a snack pack. And a snack pack is a very small volume of milk, 1 to 2 ounces, that can be used in addition to a smaller bottle feeding if the full bottle wasn't enough, rather than the caregiver warming and offering another full bottle, which the baby may only take half of, and then again, the hands are tied and they have to discard the remainder of the milk. Instead, maybe the baby takes a full bottle, doesn't seem satisfied, and they have this other bottle that has an ounce of milk they can give. So that's one reason for a snack pack. Another reason for a snack pack may be if you're due to pick up your baby at childcare at 6 o'clock and it's 5:15 and the baby is screaming, then maybe they can give the baby just a little bit of milk to tide the baby over, and then when you arrive, you can sit down, breastfeed, and ask about the baby's day. So assume in a 10-hour separation, which is roughly your 8.5-hour workday and some commuting time on either end, that your baby will take 3 bottle feedings, or perhaps 4. And roughly increasing a small volume at a time, about half an ounce at a time, until you max out at roughly 5 ounces of milk, roughly 5 months of age. So a breast milk-fed baby will almost never take more than 5.5 ounces of milk at a sitting, and that should be enough to hold them over for 2.5, 3.5 to 4 hours until their next feeding. Okay, there's a question about shaking versus swirling separated breast milk, and I do recommend holding the milk under hot running water for 10 or 20 seconds to melt the fat, and then swirling, gently swirling the milk, not shaking it vigorously. Remember that freshly expressed or refrigerated breast milk has live white blood cells in it, and shaking the milk vigorously can destroy some of those cells. So just swirl the milk. You can roll the bottle between the palms of your hand, and that may be enough to melt the fat, and then just swirl it back together. Remember that finishing a bottle doesn't mean that the baby required more milk and that next time you should make the bottles bigger. In general, you want to make the bottles the size that the baby usually finishes. If you're always making bottles that the baby leaves half an ounce or an ounce of milk, then you're making them too big, perhaps. As long as the baby finishes the bottle and then seems relatively content for a period of time, you can assume it's the right amount. So if you routinely finish your lunch, and that keeps you happy and satisfied until late afternoon when you have a little snack and then you have dinner, then your lunch is probably the right size. Finishing your lunch does not mean that tomorrow your lunch should be 25% bigger. Remember that breast milk is not digested the same way as formula. You'll see formula-fed babies taking 6, 7, and 8 ounces of formula at a sitting, and you'll also see that they have daily large, bulky bowel movements. A breast milk-fed baby drinks a lower volume of milk, but continues to grow, gain, and thrive on the same low volume of milk because the milk is more thoroughly digested, and there's actually less fecal waste on the other end. Breast milk-fed babies generally take a little bit less milk in a 24-hour period than their formula-fed peers, but they also have much less bowel movements because a formula-fed baby passes through quite a bit of milk, only partially digested, so they need to take in more milk in order to get the nutrients. So your childcare provider may be comparing what they think of as your stingy little 3 or 4 ounce bottles of breast milk to a baby the same age, the same size, who's taking 6 or 7 ounces of formula at a sitting. But it's not the same thing. It's not the same type of food. Your food is going to be more readily digested. Finally, the last bullet on the bottom left corner is just to remind you that breast milk directly from the breast is the most bioactive and the most beneficial for your baby. Then comes freshly expressed breast milk, so milk that you have expressed within the previous 24 to 48 hours. That has almost as good of cell activity as from the breast. And then milk that's been sitting in the fridge for 3 to 7 days or so would be also beneficial for your baby, although gradually some of the white cells do die off. That doesn't negate all of the other benefits of the milk. And then milk that's been frozen and then thawed is sort of the next choice on that list. So if you have freshly expressed breast milk available, that would be the most desirable to give to the baby. If you have a fair amount of milk in the freezer, sometimes moms will ask, should they be freezing the milk that they're pumping at work so that they can be rotating through and using the frozen milk? And my opinion on that question is no, not really. If you have freshly expressed milk, then that's what you should use. Let's see. So in terms of the bottle feeding itself, remember it's not just the volume of milk, it's how that milk is delivered. So the same 3 ounces of milk, if it's guzzled back over 6 minutes, you're going to end up with a frantic, restless baby who still is fussy, and the caregiver is clearly going to assume that the baby is still hungry, not settled, and probably needs more milk. Whereas that same 3 ounces of milk, if it was delivered in a nice, paced, upright, slow, responsive manner and took 15, 20, 25 minutes to deliver that same 3 ounces of milk, the baby is going to be far more content, maybe drowsy, and more settled. So use the slowest flow bottle nipple the baby and the caregiver will tolerate. Just because your baby is beyond 3 months doesn't mean you need to stop using the 0 to 3 month nipple size. You stick with the slowest flow bottle nipple until it's taking too long and the baby or the caregiver is getting frustrated, and then you can move up a size. If your 6-month-old baby is still using size 1 nipples, that's perfectly fine. A full bottle feeding should take roughly 15 to 30 minutes. And that way you will get the maximum satisfaction, the maximum benefit for your baby from that same smaller volume of milk. If you eat very quickly, then your brain doesn't realize your belly's been fed, and typically people end up eating more. Whether you're an adult or a baby, it's pretty much the same. Slower feeding is better for many different reasons, but in particular for a baby in childcare, you may not always be able to control the position that the caregiver is using to feed the baby, but you can control the flow rate of the bottle nipple. So focus on that, but do encourage the caregiver to use that paced, responsive, upright bottle feeding position. Notice the angle of the bottle in relationship to the baby here is almost horizontal, and that will help slow the feeding by gravity. And those of you that are familiar with the breastfeeding webinars know that on the main page that you click through to get here today, if you scroll down, you'll see a list of 40 different webinar topics that are recorded. This one will be added to the list later today. And at the bottom of that page, there's one that's called Bottle Feeding the Breastfed Baby, Feed the Baby, Protect the Breastfeeding. And that is a full webinar on introducing the bottle and bottle feeding rate and positions and a lot more information. Okay, so sending the bottles to daycare, make everything ready to go at home. You don't want the child care provider to need to thaw frozen milk routinely or pour milk from one collection bottle to another or blend or everything should be ready to go and labeled. Label everything, and you want to put the baby's name, the date of the breast milk, and depends if you want to put the volume or not. If you have a preference in terms of which bottles are offered in which order, then just write that. You can see here in the picture 1, 2, 3, 4, so the caregiver knows which one to offer when. So say, for example, your baby's a little bit older and they get solid foods. So maybe they eat a solid food lunch and then they have a smaller bottle after lunch. So you may give, for example, 5 ounces for the first bottle and then 3 ounces for the bottle that's offered, for the feeding after the lunchtime. So just as an example. Other people that have listened to the webinars know I've talked a little bit about melatonin transfer in breast milk, and so that's another thing too. You may want to give when you're back at work, the milk you pump on Monday is the milk the baby eats on Tuesday, and the milk you pump on Tuesday is the milk for Wednesday, and so on. So without making it too complicated, you may choose to give the milk you pump first thing in the morning. You may choose to have that be bottle number 1 the next day, whereas the milk you pump at 4 o'clock in the afternoon is bottle number 3. It's the last bottle that's given at the daycare the following day. And that just has to do with both morning caffeine, if you drink your coffee, and morning melatonin versus evening melatonin in the breast milk. Ask about if they can keep emergency express breast milk in the freezer for just in case. Some facilities can and some really can't. It may not be them being difficult and saying no. It may be a regulation that they're not allowed to store it there. But certainly if they can, then you want to keep a few bottles or a few bags of expressed milk in the freezer labeled with your baby's name just in case. And just transporting the milk to and fro in a regular insulated bag with a gel cold pack or a bottle of frozen water works fine to transport to and fro childcare. In terms of how bottle feeding goes, remember, we talked about this already a little bit, but this position, this dad or grandfather, that baby has 2 choices. When the milk is flowing rapidly because of the bottle feeding position, the bottle is over the baby and the milk is going to go quick, and the baby has 2 choices. He can chug or choke. So he is going to chug and go through quite a bit of milk very quickly. The picture on the right shows a baby who is latched very shallowly onto the bottle nipple and clamping down on the nipple, and if he tries that crap at the breast, it is not going to be pleasant. So you want to really pay attention to the position and how the baby is bottle feeding. and that will help maintain better breastfeeding on the other end, on the weekends, the evenings, and when you're home with your baby. So Dad in the yellow shirt here is doing a beautiful job with the baby semi-upright. I would maybe want the baby a little bit more upright, but what I like is the angle of the bottle in relationship to the baby's mouth. It's at a horizontal angle, and the baby has more control over the flow, slowing it down a little bit and taking a breather. And then these top pictures show a baby who's got a nice wide open mouth and is going to be latching on with the jaw dropped and the lips flanged out, more so as though you would prefer them to do at the breast. Okay, so say your baby is 5 months old, and of course, already for 2 months, the baby's grandparents have been asking, when are you going to give that baby cereal? When you were 3 months old, you were eating steak and potatoes, yada, yada. But the question is, of course, when and how do you introduce solid foods, and why do you introduce solid foods? And the reasons and the answers to these questions may be a little bit different for someone who does have a baby in childcare and is working very hard to manage to keep up with the baby's milk intake. Sometimes if your baby, if you're struggling with supply and you're just, barely getting by, if your baby seems interested and eager, you may choose to introduce solid foods at 5.5 months, which might be a little bit earlier than you otherwise might. So again, introducing solid foods, it's not a replacement for breast milk or breastfeeding. It's not going to add significant nutrition to the baby's intake, but what it can do is give the baby and the caregiver something to play with, something to dabble with. It certainly can ease the caregiver's anxiety about living ounce to ounce, about sending in these little 4-ounce breast milk bottles when the caregiver thinks the baby needs more. Because of course, the other formula-fed babies that are in the care of them are sitting down and eating these bowls of cereal and fruits and so on. So allowing that to begin sometime around 5.5, 6.5 months may be a relief for the caregiver. And once you start solid foods, although it will take several weeks to several months before there's any noticeable significant intake, nonetheless, you got to start somewhere. So gradually the baby will begin to learn to take in a little bit of food. So you can control what foods are on offer. If you give the caregiver free hand and say, sure, you can give cereal and this fruit in the morning and cereal and this vegetable in the afternoon, and remind them, don't push or force the baby to eat. I don't care if the baby eats a little or a lot. But if you allow them to play with that solid food, it may make them feel more relaxed about the feeding, and you have control over what foods are on offer. So that can be beneficial. Further up in the chit chat room before we got started, I put a link to some articles. For example, one is called Introducing Solid Foods for the Baby in Childcare, especially when breast milk is scarce. So that may be very good reading for some of you. And of course, some of these coming slides I pulled from another webinar that's on the breastfeeding webinar page. You can see the link to Introducing and Advancing Solids 6 to 12 months to learn much more about this topic. But again, here's just a nice little rough draft of the process of introducing and advancing solid foods from 6 to 12 months. And when you introduce at 6 months, you are just dabbling. So you can feed just once a day, that's fine. If it's going well, if your baby is interested, if your caregiver is pushing, it's also okay once the baby catches on to give the solid foods twice a day at childcare. You may choose to just give it once a day at home on the weekends when you're mostly breastfeeding, but on the days the baby's in childcare, if the caregiver wants to feed twice a day, you may feel comfortable with doing that. The baby's breast milk intake really doesn't change very much when you start the solid foods. Gradually, the solid foods are simply added or layered on top of the same volume of breast milk and gradually become a little bit more nutritionally beneficial and important for the baby. But it really takes several months before the baby takes any noticeable volume of solid food, and most of the solid foods that we offer babies at a young age are not particularly nutritionally dense. So things like applesauce and pureed carrots and so on, really ounce by ounce have far less nutrition, far less calorie than breast milk does. but they are getting socialized to the feeding experience, learning to sit in the high chair, open their mouth to the spoon, experiencing different flavors and textures and scents and so on. And that's a healthy thing for babies to do. If you want to start with cereal, I would recommend a whole grain cereal like a brown rice or oatmeal mixed with breast milk. If you don't have breast milk available, that's okay. If all of your ounces of breast milk are going to the bottles, then you can use water to mix the cereal with, or water plus a spoonful of fruit pureed pears or applesauce or something like that. Nutritionally dense foods to move into during the early months include things like avocados and bananas. Those are calorically dense and nutritionally dense. The orange vegetables are usually well received. For example, carrots and butternut squash are quite low calorie, whereas sweet potatoes are actually twice as caloric. So they look all the same in the little jars, but read the labels and you'll see that some actually are more calorically dense. And proteins are very beneficial for babies. So usually you would introduce cereals, fruits, vegetables, and then gradually introduce pureed proteins and yogurts. And again, much more information on that in the feeding webinars. So here's a slide. These are all live links, so you can go back to the recording later and click through if you want, or click through now and save them on your screen. But plenty of webinars and information for you on being a working mom. The first one is more about the process of being a working and pumping and nursing mom. The second one, pumping, storing, and feeding milk, is very much a how-to. Lots of pumping tips and tricks and storage information for breast milk. The third link, traveling, is a webinar I did on women that are traveling for work without the baby. So if you have to go to a conference for 3 days and you're bringing your pump and you're staying in a hotel, how is that all going to work? What do you need to bring from home? What do you need to have in the hotel? And how will you, because yes, you will, bring home every ounce of milk that you pump when you're away? Here's the solid foods webinar. And then more on the bottle feeding. And at minute, gosh, what is it, 36 or something, in this webinar, I go into the baby that refuses the bottle. But do keep up the good work, because it's very hard work during months 3 to 6 when you return to work and try to make it all happen. But the longer you go, the easier it gets. Once your baby is eating solid foods, once your supply is well established, you may be able to back down some of your pumping and pump twice during the workday, especially as your baby gets older. He or she may start having a much earlier bedtime, and so you may be able to get your third pumping before you go to sleep. If you nurse, put your baby down to sleep, say at 7:30 or 8, and then you go to sleep at 10, you may be able to pump one more time at 10 to collect additional milk and allow you to be more physically comfortable until your baby wakes you up at 3 a.m. You may be able to get away with pumping, twice at work instead of 3 times. Yeah, and then of course you've got the weekends where hopefully you don't have to look at the pump very much at all, and you can breastfeed as much as you can. When you're home, you breastfeed. When you're away, the baby gets bottles. That's a good way to kind of think about it. Okay, so next week I think I'm going to talk about weaning away from nipple shields. That was a conversation, questions that I got quite a bit on Twitter this week. So I think I'll talk about nipple shields and why and when and how they're used, how they're misused. And if you are using a nipple shield, if you were given one in the hospital, how do you gradually graduate away from it? So that's what we'll talk about next week. Please do put it on your calendar, spread the word, follow me on Twitter, follow ISIS on Twitter, and please do sign up for our week-by-week newsletter if you don't already receive it. Due to milk seeping or leaking from my 6-month-old's nose. Why would this begin all of a sudden, and should I be concerned, and can I fix it? So it's a nice connected opening, the back of the throat and the back of the nose. That's where the sinuses drain, and it's very normal to have an opening there. And that's why when you have a runny nose, you end up with a sore throat, because when you're sleeping and reclined, the thin mucus drips down the back of your nose and it goes right down into your throat, and you can taste it in your mouth if you want to. That's also why if you're drinking something and somebody makes you laugh, it can spray out of your nose. So I think your situation is the flow of the milk. Maybe you have a rapid letdown, or your baby is getting sleepy and so allows milk to pool on the back of the throat without swallowing right away. And based on the baby's horizontal position, it's kind of like you're doing a breast milk neti pot. So the milk is going in the mouth and out the nose. If you sat your baby more upright, I think that would not happen. That's, you said, should I be concerned and how can I fix it? Really, I think positional. I don't think it's a concern, particularly since it's new. I don't think it is a concern, but I do think that nursing in the more upright posture will help. And in the webinar called Breastfeeding Positions, I show several different upright positions. You can have your baby straddled over your thigh. You can have your baby in a sitting position, a kind of a modified football hold, but the baby being propped and sitting. You can try having your baby sitting on your lap facing you, and you can also have your baby on top of the breast rather than under the breast. So imagine you're sitting on the couch, put your feet up on the coffee table, and lean way back in cross cradle, and bring the baby on top of the breast rather than under the breast. All of those positions, I think, will help. But I don't think it means that your baby has some kind of reflux that's a problem or anything. Here's a question from a mom who says, how does introducing cow's milk affect breastfeeding? Son is 11 months old, and I'm thinking of introducing cow's milk at a year. So it would affect breast milk the same way introducing anything else, whether it's formula, cow's milk, any volume of milk that's going to replace a breastfeeding. It would be a gradual, slow weaning process. And you could introduce cow's milk in a sippy cup or a straw cup or a bottle. If your baby does not seem to like the taste, a couple of suggestions. My first suggestion would be, although ultimately you'll probably want to use whole milk, if they're balking at the taste or adjustment of cow's milk, try using 2% or 1% milk initially, because the taste and the thickness is a little bit more similar to